Uh, Welcome to the Life and Breath podcast, where we bring you information from professionals and patients that will improve your pulmonary health and overall health in spite of lung disease. My name is Lee Fogel. I'm the author of A Matter of Life and Breath, which is about my journey from nearly dying from severe pulmonary fibrosis to today being pretty active and living a full and enjoyable life and getting to talk to some wonderful people on this journey. And one of those I'm very excited to talk to today. I've heard so much about her from one of the patients that I've been in a group with who the patient and his daughter has spoken so highly of Jackie. So I'm very pleased to have a conversation today with Jackie Rodrigues. Jackie is the supervisor of pulmonary rehab and respiratory at Northwell Hospital in Sleepy Hollow. Uh, Jackie has been involved in the community outreach for 12 years, and she's provided anti-vaping education, which is really good stuff. And that vaping is, I've seen some people who've had some lung damage from vaping with hot vapes. And she also does pulmonary rehab education. She was an in-house registered respiratory therapist for 9 years of her career, but in the past 6 years, Jackie has worked in the pulmonary rehab side of respiratory. So for all my lung peeps out there, Jackie speaks our language, and she speaks my language, especially about the importance of movement and activity to keep us alive. And it's just the secret. So, Jackie, welcome.
Thank you so much. Thank you for having me. I'm very excited to be here and get to chat with you about, the things that I love, which is, lungs and exercise and moving and, patient care.
That's so good. Thank you so much. Well, we're gonna dive right into that. So, tell us a little bit. Anything else you want to tell us about you? Anything you like to do, your hobbies or whatever outside of work? You can tell us anything personal that you want to be broadcast all over the world because people will watch this all around the world. And
Got it.
and then tell us about what are the most important things you want to cover today in this podcast.
All right. So, a couple things about me. I am a mom of two. It is a huge part of my life. I have two beautiful children, a wonderful husband, a great dog, and my family keeps me very busy. It's one of the reasons I actually had transitioned to pulmonary rehab, outpatient, and things like that to have a quality of life with my patients, but also with my family. I officially am walking on May 21st to graduate from. I got my master's in adult education this year, just finished. Um,
Congratulations.
Thank you. And I have a sweater that says lung nerd. And I think that, that's very define, it's a definition of who I am. I love I love my career path. I love where my job has taken me. I love my patients. My team I work with is tops. And, I feel very blessed to have the life I have and to have met the people and had the experiences that I had. In-house in the hospital was fantastic, triaging, ventilators, emergency room, all of that was a fantastic experience in my life. But what I definitely missed and what I've gained from switching over to the pulmonary rehab side and the community outreach side is relationships. You get to
Mm,
advocate for your patients, you get to be a part of their life and their planning and their care. And
mm.
for me, I mean, that worlds above the rest has just been personally and career wise life changing.
Beautiful. That's beautiful stuff. And that's how your name came before me is because talking to a person who's a caregiver for an 84-year-old father, a veteran of the war who was recently passed on, she said, "You've got to meet Jackie. She's just been, Mike loved her and she was so helpful to all of us." And you take that to heart and you walk that walk of staying connected, with your patients. I love that relationship. So continue on. Don't let me interrupt you, but tell us the kind of things you want to focus on today for all the folks out there who are struggling with a lung disease, who may not be able to do things as well as they used to could do them, or not at all.
So, a couple of important things these are things that when I teach rehab, these are things that I talk about regularly, right? So, don't be stagnant. And I mean that in a couple of ways. Don't stand still. One, mobility. You got to move. Move a muscle, change a thought. Moving keeps us alive, keeps us going, where our bodies are not meant to be in one place, right? But also, when I say don't be stagnant, don't stop advocating or pushing for your care. Because I think sometimes when we hear people say, well, that's it, that's all we got, or this is your disease process, or, well, this is just what it is. That's not really defining an answer. That's kind of just throwing our hands up. And there are so many other options out there for patients these days. And there's communities and there's growth. And you will find, if you keep looking, maybe not the cure to what it is, but you will find an environment where you feel, this is my place, these are my people, right? And that quality of life, that change in mentality and physicality can be a huge difference for people, right? We got to be in a place that's going to keep us moving, but we got to be with people that are going to keep us going too.
Hmm. Good stuff. You said something a moment ago, move a muscle, change a thought. Unpack that more, because I kind of like where think that was going.
So there's a lot of science behind when we're mentally not feeling ourselves, right? When we're sitting in it and we're just down on our luck or not feeling well, it's easy to get very negative. And it's scientifically proven, but also just from personal experience. When you get up, when you start mobilizing, when you put work in, and yes, it is tiring and it is going to be difficult in the beginning, it really does change our outlook. It's not the I can't do that, it's I couldn't and now I can. Or, I always say it's not that we can't do something, it's difficult. But the more you practice at that, the less difficult it becomes. And that's so important to understand. Anything worth really achieving, you got to work towards it. And, it's important to find the right group to help you do that. But ultimately, it's on us to do the right thing and put ourselves in that position.
Hmm. Spot on. Spot on. It harkens me back to the early part. I got my diagnosis after two bouts of pneumonia in early 21. I was given oxygen and sent home without much instruction on what to do with it. And everything was still shut down from COVID. And I took the heaviest thing I had to lift was the remote control. And I sat in the recliner and watched old episodes of Yellowstone and whatever. And I declined precipitously. I went from having been an Ironman triathlete, able to, race, 142 miles in a single day on bike, swimming, and running, and to not being able to walk 50 yards and carrying oxygen, and the less I did, the less I could do.
Yeah.
And when it turned around through pulmonary rehab, which was one of the key factors in turning around, and I began to move, and I felt better, and I felt less sad, and stopped planning my funeral, and I focused on what I could do, and it was difficult. It was embarrassingly difficult to take that oxygen tank to a gym and ride 2 minutes on a bicycle and have to go rest, and it was very difficult. I did not have the luxury of working with someone as effective as you. Or who knows where I'd be. Maybe I'd be back racing Ironman triathlons if I'd had you in my life back then. But it did turn things around, pulmonary rehab. So tell us more about the kind of folks whatever you want to do. You take this where you want to go. The kind of
Sure.
people you see that come into your facility, and what do you do with them, and that sort of thing.
So we have patients enter our facility and all types of lung disease, asthma, COPD, interstitial lung disease, transplant patients, people waiting for a transplant from their disease process. Um, and they come in and we evaluate them. We do a 6-minute walk and kind of give them an abundance of paperwork. And I tell them it's not because we're nosy, it's because we want to get to know them and help them, but also maybe we're a little bit nosy. And we learn about them and their lifestyle. We also invite their families in for education as well, because, it's not just the patient, it's the caregiver. And we want as many resources for that person as possible to be involved, which is huge, right?
Mhm.
Um, 2 years, 4 years are better than two. So we do the 6-minute walk. We learn about nutrition, lifestyle. What are you doing? What do you use at home? Do you have air conditioning? Is it central? Is it window units? Are you active? Do you drink enough water? How's your diet going? All of these little tidbits. How do you sleep at night? Those are huge factors for healing process for our body. Once we get them evaluated, we put them into our education session, and we have 6 education sessions, and we cover, the gambit, disease process, particularly looking at our group who we're educating. Is it COPD? Is it ILD? We kind of try to narrow it in on that process for them and kind of touch on a couple of components. The key being, we might be here for different diseases, but we're all feeling the same thing. And that's really important to take away from that. We have dietary come down and talk with our patients. We talk to them about weather. We talk to them about home exercise. We talk to them about how, proper breathing technique. You'd be amazed at how many, not just people who can't breathe, everybody breathes wrong. It's amazing. And we kind of just run a gambit on things you need to know to give you a tool belt. And then we start moving you. We start with, taking the stairs. How do we do that effectively? Something I always say that drives my patients nuts. I've never seen anybody move as fast as a person who can't breathe, because everyone thinks the faster they push through it, the sooner they get to the top of those stairs or the end of the hall, the sooner they get to stop and rest. And all they're doing is pooping themselves out. They're going to be exhausted by the time they get there, and then they have to stop and recover. Whereas if they took their time and breathed and used these tools, they could continue going, or they wouldn't be as in distress, which can put us in a bad situation as well. And then, with education, they get to meet people who have similar difficulties in life, or, the same obstacles as them. And we kind of work through it as a group together. Showering's exhausting, eating's exhausting. How do we improve this? What's the best time to use pursed lip breathing? Diaphragmatic breathing. We strengthen. One of the biggest things we do at our rehab facility is diaphragmatic breathing. We have them lay on the table and put weights on their diaphragm and teach them how to
Excellent.
use those weights and strengthen that muscle. It's the biggest breathing muscle we have. We also have a lot of fun while we're doing this, because I always looked at it this way. I've never met a patient in the hospital who was like thrilled to be in the hospital. It just doesn't work that way. And realistically, it's an outpatient facility, and I want to be the place people consider their second home. I want people to be like, I can't wait to go to rehab. I can't wait to get in that gym and see the people in my session. We have women who go to lunch together now and talk with each other. We have morning guys who, have their donuts together, and we try to laugh and, share life with each other, because that's really what this is about. There's no point in sitting in a gym and pedaling away being miserable, right? We want to make this, and I tell people, it's my job. It's always going to be my job to ask a little more of you. Can you go up a level on the new step? Can we go up on your speed or your incline? Do you think you can do a little more weight? That's always going to be me. But within reason, you can always say to me, hey, Jackie, you know what? Today's not a great day and I'm struggling. I get that. All right, so we take it a little easier. Today, we're just about keeping the body moving, right? Maybe we're not making those extra steps. But if you come to the program, if you really participate, get moving, start doing the things that we talk about. Listen, we're not going to cure lung disease. It's chronic. It's always going to be with us, right? But we can absolutely improve quality of life, quality of exercise. For some people, maintaining is a huge, because we have so many ups and downs. Just a maintaining of the current level and staying exactly where we are is perfect too. Everyone's story is a little bit different, but whatever the goal is for our patients, I have some people are like, I babysit my grandchildren. I got to be able to go to Disney. All right, so what do we got to do to get
Right.
you ready for that? Or,
Right.
my apartment, my elevator goes out all the time. I got to take the stairs. All right, what do we got to do to get you through these goals? And we will absolutely help with any goal they have. And realistically, I always tell our patients also, if you have a question, ask. And if I know the answer, fantastic. We have several therapists in the gym with us. There's a lot of experience between us. And if I don't know the answer, I will find it for you.
Hmm. Well, you bring back memories when you talk about us elevators. I was living in downtown Sarasota during my earliest days of preparing to die, and I was on the fourth floor, and the elevator was terrifying because at the time I used a portable concentrator, which was very weak for me. I needed a tank, and we didn't realize that really. The concentrator wasn't enough oxygen. So I'd get in the elevator, and the doors would close, and I would be terrified that it would stop on the way up and I'd be caught there. So there's
Oh no.
oxygen anxiety. The same thing that happens when we get in the shower sometimes
Yeah.
without, actually hang the cannula over the shower door and use it. But I remember I had that problem, but I didn't have you in my life, so I couldn't take the stairs. The stairs were out of the question to take 4 flights of stairs at that time. I didn't know how to get up there. It just was too hard. So what did I
Absolutely.
do? I hired dog walkers to walk my dogs for me and stayed on the recliner and continued to decline in my recliner, and even developed pulmonary embolisms as
Oh
a
my
result
goodness.
uh, of inactivity.
Yeah.
So inactivity is horrible for lung disease, folks. I love what I'm hearing from you, though, about your holistic approach. You ask all these questions. I haven't talked, I never had all that sort of thing. So there was no open facility for me to go to during that time. Everything was closed down. And I know a lot of folks who have not been to pulmonary rehab. They've gotten the diagnosis. So a tech showed up and delivered oxygen tanks without a lot of instruction on
Yeah.
using it like that. So you do this in a hospital setting, and you have an outpatient clinic there. Um, but the vast majority of people who are listening to this, if they're in your area, certainly they want to. It'd be great for them to get there to you and meet you. But what can people do who are not able to do that? And maybe there are a lot of people who are remote in parts of the world. I have a friend in Iceland who has this, and he's
Wow.
a dairy farmer in Iceland, and he contacts me because he read my book, and so he's but there's no pulmonary rehab near him.
Yeah.
What sort of message do you have for folks like that?
Small goals, right? So we want to set achievable goals, and that's really important, right? So I don't expect somebody to come in and be like, I'm going to walk 20 minutes on the treadmill at a speed of 3 and I'm just going to crush it, right? Because that's not realistic, right? We have to set ourselves up for success. And I always think of my grandmother. My grandmother had COPD, and her name was Grace. And I always think, give yourself grace, right? Give yourself a break. We have to be kind to ourselves. Our patients are the toughest on themselves than more than anyone else is in their lives, right? And if we can set small goals each day, right? If you're sitting on the couch and the only thing you're doing right now is lifting the remote control, make it a goal to get up and just walk down the hallway for the first week once a day, right? I'm just going to get up, I'm going to get to the end of that hallway, and I'm going to go back, I'm going to sit in my chair, right? And you're going to feel tired. Shortness of breath is terrifying, and it's even more terrifying for somebody who struggles to breathe. But I also tell people, if you think about athletes, right? People who are in really good shape, when they're pushing themselves athletically, they're short of breath.
Absolutely.
It's when you can't recover, that's when we have to stop and think, right? But to move, and when that's exercise for us, you are going to get short of breath, and that's okay. It is okay to be short of breath. People say, I can't breathe. I can't breathe. No, no, no. You can, because if you couldn't, you wouldn't be here with me right now. You
Right.
can breathe. It's difficult to breathe, right? And what we have to do is learn to sit, use our pursed lip breathing in through our nose, out through tight lips, recover. And after we've done that, lapped up the hallway, maybe give ourselves a little grace and a little break. And then maybe the second week we do it once in the morning and once in the afternoon, right? That extra walk up and down. Or maybe when we're sitting on the couch, maybe our legs are too weak and we don't feel stable enough to walk up and down the hallway. Maybe we sit and we just do leg extensions, right? And you can YouTube video it, or there's plenty of exercise videos out there now, but sitting and just rotating your ankles, doing the alphabet with your ankles. That's exhausting. It's exhausting for me. People don't realize how hard that is to do. Out a capital or lowercase, whatever you choose. Straight leg extensions where you just sit, and from the knee you just lift, and that's going to help strengthen your quad. When you're, standing at the counter, if you can do heel raises just with body weight, there's so many little tidbits that we can add to our day. And I always tell my patients, if you just do one extra thing a day, that's a huge success in my eyes. you know,
Absolutely.
one
That's
extra thing a day.
I've never heard of the alphabet thing. That's kind of cool. So you do it with both feet at the same time, each
No,
letter, or you do one foot at a time?
I do one foot at a time, because it's actually when you sit and you think about the alphabet and how to draw it out with your foot,
Right.
it's a thought process,
That's
but
I'm trying to picture that right now. That's a
your
very cool
ankles will be
exercise.
very tired.
Yeah, and I talked to so many people about the importance of movement for our lymphatic system to keep the lymph flow
Yeah,
going, and the movement of that lower leg. That's a beautiful way to pump the lymph system as well as pump the heart or the blood flow from your calves. So that's
absolutely.
very interesting. I like that. That's right. Write that one down, everybody. Um, Good. We'll continue. I don't want to interrupt you.
So some of the things that I look at, I'm kind of taking a peek at my notes to make sure I touch everything. You know, if you're home, if you can get into a program, one thing that we've been lucky enough at our hospital, we have a maintenance program for our patients. So we talked about people who, their insurance may run the gambit, or it might run out, or they only get so many weeks of it. It's not easy to go and work out at a gym, especially when you need oxygen, and especially if you're on a portable concentrator, because that's pulse dose. It's not a continuous dose. So we always feel like we're air hungry, right? We can't get enough in. So we have a maintenance program, and we're very lucky to have that. So when our patients do graduate or they cap out on insurance, they can pay basically a gym membership fee, and they keep their time with their friends, and they can
That's
still
cool.
come in and exercise. For those patients who maybe can't do that, or we had one lovely lady who was with us from Las Vegas. She was visiting her daughter, ended up having some serious issues and staying down in New York, and then moved back to Las Vegas. We talked to her about, like, listen, bring your concentrator, bring, your pulse oximeter, but we always teach about pulse oximetry because it can be our best friend and our worst enemy, because if we got Raynaud's or poor circulation, you're not going to get a good reading and everyone panics, right? But within reason, do things that are going to be stable for you. Sit on the recumbent bike and pedal, right? Watch your oxygen, use your concentrator if you don't have access to a gym or something that has free flowing oxygen. The treadmill might not be the right thing for you because we're using so many more muscles when we're on a treadmill. Weights are fantastic. I cannot say enough. Our muscle deterioration is huge when we don't move. And
Mhm.
I always compare, my husband's a car guy, so I always compare our bodies to a car, right? If you keep up your maintenance, right, you change your tires, you change your oil, you get more gas mileage, right? Our gas is oxygen. When our muscles are out of shape, we consume more oxygen. Our body needs more oxygen to function. So by adding just light weights, right? I'm not telling you to go pick up 20, 30 pounds because that's crazy, but just by doing those routine weight exercises for your arms, your legs, things like that, weight training is a huge thing for just overall health, muscle development, and kind of giving your body an extra line of defense, right? Um,
Mhm.
it's really impressive to see when somebody's on a treadmill. I always ask them when they come to our gym, when they get off the treadmill, I say, what stopped you, your breathing or your muscles? Right? Because if
Yeah.
it's your breathing, I can give you more oxygen in pulmonary
Hmm.
rehab. I can support that. But if it's your muscles, that means our muscles aren't to the point where we're going to fatigue ourselves, right? Let's add leg weights. If I'm on the
Hmm.
treadmill and my legs are bothering me, I need to do weights because my muscles aren't strong enough to push me where I need to go. And so I always
That's
make that comparison.
that's a
What's
good
tiring?
comparison. That's one of the listeners need to pay attention to right there. What's really bothering you is say that again. What's really is it your must?
Is
What
it your
caused you to give up?
breathing?
Yeah.
Is it your breathing stopping you, or is it your muscles stopping you? Right?
Boom.
Because I've had patients, they're
Beautiful.
walking on the treadmill and they'll stop. And I notice, because we always ask, what's your shortness of breath, right? That Borg scale, 0 to 10. And they'll look at me and they'll be like, I like a 1. And I'm like, so what? Nicely, why are we stopping? And they'll be like, oh, my legs are exhausted. Okay, so that tells me it's our muscles that we got to
That's good.
condition.
Yeah. Okay.
If your breathing's still good, that means we've got room to grow on your muscle development. And that's really important too.
Mm. Good stuff there.
And that's also
That's
good for balance and things like that too, which a lot of people get concerned with.
so true.
And
Yeah.
I also don't, my grandmother used to say, don't bite your nose to spite your face. So the biggest thing that I watch people do is they ignore or avoid because they don't want to seem like they can't, right? So I'll have
Um,
patients who maybe their walk isn't as strong as it should be. Okay, well, what about a cane? Oh, I don't use it. Well, why not? Oh, well, I just don't, it doesn't help, but then they'll be walking and I'll see that they're unbalanced. Or concentrators are so heavy. Tanks are so heavy. It's okay to have a rollator to put that oxygen on, because one, that throws you off balance, right? Because you're carrying this heavy weight and we're already weakened. Use the rollator and say, I don't need the rollator, my concentrator does, right? But it gives you more
good
balance.
point.
Your muscles aren't working as hard. You're not going to have to strain as much. You're not going to have as much breathing difficulty because you're giving your body support and you're having it do the heavy lifting for you. Because anyone who's carrying groceries, concentrators, anything that's adding weight to our body is adding work to our body. And until we're at a point where we can do that safely, the reason we have these things is to support us and make sure we're safe so that we can get up and exercise and we can get up and go to the store and do all these amazing things, right? We just have to learn to work with what we have.
Hmm.
And
So
that's so
true.
important.
Very good. Very good. Tell us about any success stories. And do you have any patients that come to mind that they came in at one level and they went out at a different level, and how they did it, or vice versa? And
So
there's
I think of this in several different ways, right? So if we're talking success in the gym, right? I had one lady who used to come in but when she first came to us, she could barely do 2 minutes on the treadmill. And she would give it her all. And she was, I'm so tired. I got to sit down. And she was short of breath and she was huffing and puffing. And I was like, that's all right. Sit down. I was like, we're going to support you. We're going to do this. We added leg weights. And every day she'd come in and, we'd alternate. Maybe we do treadmill, maybe we do leg weights. We'd recover with diaphragmatic breathing. And she kept working to the point where she was able to eventually do 15 minutes consecutively on the treadmill. And that was a huge
awesome.
success for her. She never thought she'd be able to do that,
That's
right?
awesome. Yeah.
I also look at success. We've been blessed enough to see a couple patients receive lung transplants, watching them come in on 6 liters, huffing, puffing, blue in the lips, right? And we're just kind of pushing till we get to that point that we've been waiting for. And the best call I get is from a family member saying, we got the call, they're going into the hospital, right? And I've been around to see 3 or 4 people at this point get transplants, and it's an amazing gift to watch that. And that's something that's successful. But the other thing is, when you talk about the patient that you met of mine, and I have another patient where we get very close with the families, right? Because we always invite the families into our gym and for education. And one of my patients said, his doctor told him with his diagnosis he had about 4 months, and he was like, yeah, okay, doc. He just kind of blew him off. And over about a year and a half later, he was like, he goes, that doctor who told me I had 4 months, he was like, huh. He goes, yeah, I showed him. And, that quality of life, that positive outlook, that get up and go. And just to know that we can positively affect families and patients to a point where they feel so supportive that even though a doc may not agree with it, we don't know. We don't have expiration dates stamped on our foots. You know,
Right.
it's crazy to see somebody put a time or a date. It's going to happen to us all eventually, like, at the end of the day. But I would never tell somebody, well, it looks like you only have X amount of time, you know?
Right.
And another thing that I think is really successful for me that we started doing in our program is the initiation of palliative care. Palliative is not hospice. I cannot say this enough. My patients, when I mention palliative care, they all look at me like I'm like writing them like the goodbye note. And I'm like, no, no, no. Palliative care is meant for anyone who has a chronic diagnosis, right? It's to better their quality of life. We are so blessed. We have an amazing palliative care team at our hospital, and we started working with them. And if I had a patient who was like, well, the doctor says this is it, I'm just going to feel this way, I was like, let's send you over to our doctor and see what they could come up with, right? Because palliative doctors look at resources differently. They look at medications differently. They look at quality of life differently than your standard primary or pulmonologist, right? And don't get me wrong, all doctors serve a purpose, right? Palliative just tends to have a little bit of a different scope of thinking on these things. And I've sent patients over to our team, and they come back and they're like, I am so happy you put me in contact with them. Our palliative team is geriatrics, palliative, and hospice. So it does have the full gambit in there. But palliative care is meant to improve quality of life. It's not meant for end of life. You're still getting treatment, you're still getting care and diagnoses and seeing a doctor on palliative care. So I don't ever want patients to think that that's something that should hold them back from seeking another resource that can provide them a better quality of life.
Great point. And I've had this discussion a while back with someone, about the palliative care being quality of life. I've done hospice, volunteer work with hospice, and I know the difference in hospice and palliative. And I say to people, look, between me and my doctor, this is me. I'm on palliative care. This oxygen cannula, I carry an oxygen tank with me. I go to the gym and I work out. I go everywhere I want to go. I do what I want to do. And this gives me a quality of life to be able to do it. Oxygen is my superpower, but it's a form of palliative care.
Yeah,
And so,
it's a
so
treatment.
absolutely, absolutely. And it doesn't mean I'm at the end of life. Yeah. But as some people I see sometimes, sadly, on Facebook and social media, that people say I've been diagnosed with this disease. It's terminal and it's incurable. and it's going to kill me. And it's like, well, you know what? Last I checked, aging is an incurable thing too. We're all
Yes,
gonna die,
it is.
and I joke around with it and say I think I'm nearing the end of life. I may only have 20 or 30 years left. I'll
But
go through a
when
lot of
you
cannula.
say, when we get diagnosed with these things, it can feel very diminishing, right? Like, oh,
Yeah,
you have this disease, right?
yeah.
And sometimes I also think, and I do talk about this with our patients, quality of doctor. And listen, doctors are not easy to find. They're not easy to get appointments with sometimes, and we're definitely in a battle where we need more of them. But I also advocate for, you want to be able to talk to your doctor. Sometimes we settle because this is who we've been seeing for forever, and, or they retired and I got the guy who replaced him,
Hmm.
whatever it may be, right?
Right.
I have been blessed enough to meet really fantastic doctors who will talk to their patients. If your doctor's saying, well, this is what we can do for you, and this is kind of where we're at. If the nebulizer's not working, if the inhalers aren't working, then you're kind of where you're at, right? There's so many other doctors out there who are going to push you, like, hey, listen, why don't we try pulmonary rehab? Or, why don't you go see this person? Why don't we talk to a palliative doctor for quality of life? And I can't lie and say, like, listen, having something chronic, right, where it affects, like you said, you couldn't do your races anymore and things like that. It is naturally, we are human. It is gonna kind of throw you down a little bit, right? But you can't let it knock you out for the count, There's still more life to live. And there's also so many resources people don't know about. There's the Pulmonary Fibrosis Foundation. There's the American Lung Force Association. There's so many resources. There's silver sneakers at some of the malls in our area. We host a Better Breathers and a community outreach program where we've done chair yoga and had our palliative doctor come and talk. And there are places out there where if you're not feeling or you're feeling like this is it for you, go to these places, at least give it a shot once, because you would be amazed at what seeing other people who are in the same spot you are, maybe better, maybe worse, and their outlook on life, right? And say, you know what, if they feel that way about this, I could feel that way about this too. You're such an inspiration for people. You have such a positive outlook on, this process and still going through it and exercising and moving. And, the more people that see that you can still enjoy and have a good quality of life, even with these things kind of going on, it's so important for us to realize a diagnosis isn't an end of life sentence. It's a diagnosis. We can work through it,
Yeah.
and we'll if you find the right people, you can definitely find the bright side of it. We can
Yeah.
definitely still have an amazing quality of life even with these things going on.
Yeah, that I think that's valuable, and one of the things that we do with pulmonary success circles, which is how I met Mike and Erica, is we're a volunteer-led organization, and we've got 11 volunteers who each facilitate a group of 8 to 10 patients, and we meet weekly on Zoom. And I've been leading a group for a couple of years. I'm leading a second group now for another year, and it's two of my favorite times of the week: 1 hour meeting on Thursday, 1 hour meeting on Friday. And we sit around with 7, 8, 10 of us, and we talk about what's going on in our lives,
Mhm.
grandchildren, events we're going to, or problems we're having. We sell our celebrations and our what we're navigating. And it's a way to be connected with that community. So even when people leave your facility or are unable to get to a face-to-face facility, looking for one of these. We're not an educational support group. We don't sit around and show a bunch of slides. We sit around and
Right.
talk to each other. And
Yeah.
so that's very important. I'm going to, as you think about a summary, I'm going to give a couple of things I need to do on this, a
Sure.
disclaimer and a reminder that if you have found this kind of information useful for you or a loved one or a person who has a lung disease, please give us a thumbs up on the little YouTube bar there. Give us a thumbs up, subscribe for more, and hit the notification bell, and you'll get more videos. We try to post videos once every week or two, interviewing patients and doctors and therapists and various things. Also, leave a comment in the description below. You can leave a comment if you've got a question for Jackie. She'll be watching this, and Jackie or I will try to answer any questions that you may have in the comments. So leave a comment, ask us a question or tell us what you liked. If you didn't like it, just don't tell us. And a disclaimer that I have to say before we finish today is that this information in this video is provided for general information purposes only and educational purposes only. It's not intended to diagnose, treat, cure, or prevent any disease, nor should it be considered as a substitute for a professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified healthcare providers with any questions you may have regarding your health or a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard me say on this video. Furthermore, there is no commercial affiliation with any product or service ever mentioned in any of my videos. We have no, we don't get money for clicks. We don't do, there's no monetization of anything that we do in this channel. And we, I guess that's the end of that disclaimer. And so I'll ask Jackie to sort of land this plane with any final parting words she wants to pass along to you folks out there listening.
All right. So final words. Don't give up, right? That's so important. If you think, I'm trying to think of like the right thing to say because there's so much out there for us. And I watch people every day come in who struggle, in various different ways, hot, humid days, cold days, whatever it may be. And there is a quality of life beyond this. It hits you hard. It's definitely something that, people who have lung disease have a superpower. They really, to get up and get out and keep going, it's amazing. And to find your people in a way, right? The people who get not only sympathize with you, but empathize. They know what you're feeling. They understand what you're going through. They're out there, and give yourself grace. When we have a lung condition, when we're not feeling our best, when we have to adapt to new challenges in life, it can get very disheartening. But there's so many people out there who are there to help pick you up, and I don't want anyone to ever feel alone. And I think that that's so important.
Good. Well, thank you. That's a good summary. It is. And we're not alone out there. There's ways to connect with us. And thanks for
Yes.
all the great work that you're doing, Jackie. If we encounter any folks anywhere near your region of the world, we'll send them your way. And if you
Send them on over.
send them out to our YouTube channel also, so they can connect with us and maybe connect with one of our groups. If they're
Perfect.
all alone out there and
Yes.
feel alone, then connect with the community of people who are. What we try to do is forget we have lung disease.
Mhm.
We like to don't focus on what we can't do, focus on what we can do.
Absolutely.
And most days I just forget I have it. When I get off this phone, I'm gonna put me a new D tank in my backpack and I'm heading to the gym.
Perfect.
And life is good. Thank God for oxygen. It's our superpower. And so thank
Yes.
you, Jackie. It's been a real blessing to get to know you today. Keep up the great work you're doing. And
Thank you so much.
we'll
And same to you. Keep up doing these amazing videos and giving people the opportunity to see what else is out there for them. And, it's fantastic what you do, and keep exercising, keep moving, move a muscle, change a thought.
I love that. Move a muscle, change a thought. Maybe we'll put that as a title. Anyway, thank you so much.
Thank you.